Hello, my name is Denitra Brown, and I am doing a narrated PowerPoint for Nursing 527. My topic of interest is African American women and diabetes. The risk of developing diabetes among African American women is great. Diabetes affects 1 in 4 women ages 55 and older and is listed as the 4th leading cause of death for all ages. Among African American women, diabetes has reached an epidemic proportion. According to the National Women's Health Information Center, Office of Women's Health, Department of Health and Human Services, 2002, diabetes is 60% more common among African American women than among white women. So you ask yourself, well, what is diabetes? Well, according to the Mayo Clinic, diabetes mellitus refers to a group of diseases that affect how your body uses blood sugar or glucose. Diabetes, often referred to as sugar, is a serious, common, and costly disease. It is a disease in which the body does not make enough insulin or cannot use the insulin it makes effectively. So, insulin is needed to help the glucose or sugar that is produced when a person digests food that is entered into the cells of the body. Diabetes is a lifelong condition and will steadily worsen unless a person makes consistent and healthy lifestyle changes. Risk factors for diabetes lifestyle affects many of the risk factors of diabetes. And these risk factors are conditions or habits that increase the chances of diabetes itself developing. So you ask yourself, well, what is these risk factors? Now, it's not totally understood why African Americans develop diabetes, but it's clear that certain factors increase the risk. And these factors include weight. So the more fatty tissue that you have, the more resistant your cells become to insulin. Inactivity. Physical activity helps you control your weight. It uses the glucose as energy and makes cells more sensitive to insulin. Your family history. This also increases your risk factors. So if you have a parent or sibling with diabetes, it is pretty much a thing that you're going to have diabetes. If you are black or Hispanic, American Indian or Asian, you are at a higher risk. So your age can help aid in the increased risk. Your blood pressures, abnormal cholesterol, triglycerol levels, all of these things play a part as risk factors in developing diabetes. And with these risk factors come complications. The resulting common and debilitating complications include like heart disease, strokes, and then you have those bad complications like blindness, amputation of lower extremities, and dialysis due to kidney failure. So here I've listed statistics in African American women. This is an age adjusted prevalence of diagnosed diabetes per 100 population, and these statistics were taken back in 2014. And as you can see, they've listed the African Americans, men and women, as well as our white counterparts. And you see here where both the African American men and women are at a higher percentage here. Also, on this other graph that I've included, this is diagnosed diabetes, gender adults with diabetes. This is a age-adjusted percentage, and this is within Alabama. And the green and blue here represent male and female. So you can see how the trending took place over the years, the up and down trending. And it listed that in 2016, males were 13.6% and females were 12.9%. So you can see, even though within that time frame the males were at a higher percentage than females, you can still see where females range in a high percentage of contracting or being diagnosed with diabetes. So what is the prevention? You want to make sure that you eat healthy foods. So you want to choose foods that are lower in fats and calories and higher in fiber. So that means you want to focus on your fruits, your vegetables, your whole grains. You want to make sure that you get physical activity. And you want to do this by aiming at 30 minutes of moderate physical activity daily. So just something simple as taking a brisk walk, riding your bike or swimming, whatever you think that you can do that will be beneficial in the prevention. You want to make sure that you do this on a daily. And I also read that just 7%, if you're already overweight and you can lose 7% of your body weight, this can help in the reduction of your risk of diabetes. Vaccinations is also a preventive. So you want to make sure that you get your flu vaccination and your pneumonia vaccination per your doctor's orders. So where does the advanced public health nurse play a part in this? So the role in helping with prevention and strategies for people at risk for diabetes. So as nurses, we always want to educate our patients. This is part of our jobs and our careers. We always want to educate so that and put interventions into place to help our patients so that they can understand their disease processes. So it's just at a greater role when you become an advanced public health nurse. You want to make sure to implement both diet and physical activity promotion programs, and you can this can include counseling or coaching or both. You want to develop and collaborate with case management to establish interventions in order to coordinate and provide health care for people affected with diabetes. You want to make sure that you engage the community. So community healthcare workers, you want to engage them so they can help in the prevention or coming up with programs to help improve glycemic control and weight-related outcomes for people with diabetes. You want to develop intensive lifestyle interventions, as we were talking before, like exercise, dietary modification, your weight management. And when you're doing all this, you want to make sure that you have team-based care interventions into place. So, you want to talk with your patient to ensure, and also if they have a support system, you want to involve them. So when you're planning and you're putting all your interventions into place, you want to make sure that all of the goals are obtainable for the patient. And I just put another graph in here so you can see, we do monitoring and evaluation. We do an assessment of the patient to see what it is that they need, goal setting. Want to make sure you set goals and planning. And that's when you want to include that support system so that the patient will have them, to help in the management of prevention. Or if they actually have diabetes, you want to help them to have somebody so that they can get the treatments, go to the doctors, and do all these things that they need to do to decrease their risk factors. So what can I do? Risk factors are great among African American women. So again, managing your diabetes is the key. You want to make sure that the management is effective. You want to do this by having regular blood pressure checks. You want to monitor your glucose levels, cholesterol, triglycerides, your kidney function. You want to make sure that you're getting regular eye checks, feet, teeth, and gum. People don't realize it, but all this plays a key part in diabetes. All these things can be affected. So you just want to make sure that you are managing and having regular checkups of that. And here I put another, just something so you can see what, if you have diabetes, you want to make sure you're taking your medications. Here's your diet. You want to maintain your proportion and make sure you get your exercise as needed. So in conclusion, education for self-management and prevention is essential for both prevention and care of diabetes. The advanced public health nurse plays a crucial role in providing patient care and promoting self-care management. The care provided by the advanced public health nurse can improve outcomes and assist in delivering cost-effective care. Duncan et al. Found that patients receiving diabetes education had lower overall healthcare costs. He found that these cost patterns were improved when diabetes education was delivered by advanced public health nurses or diabetic educators in accredited or recognized programs. So training and education and support can be provided to healthcare professionals, and it should be provided in community settings and homes. This has been proven essential in the effectiveness of prevention and management strategies of diabetes. Thank you.